Hello and happy Friday to our Mercy College of Health Sciences Facebook community, to our students, our staff, our faculty, our alumni, and all the followers of Mercy College of Health Sciences. Happy Thursday. I'm Andy Gress, the Director of Enrollment Management at the college, and I'm joined today by our Provost, Dr. Nancy Kurtz. Welcome, Dr. Kurtz.
Hello, Andy. Hello, everyone.
If you were able to join us last Thursday, you joined us for a deep dive into our accelerated nursing program. If you didn't, make sure you check out the link on our page. I had a great conversation with Dr. Chris Steffens. We talked about everything from being interested in an accelerated program, what an accelerated nursing program is, and everything to the finish line. So it's a great video and a great conversation. If you didn't get to check it out, make sure you go back and see that. But today, Dr. Kurtz, it's all other things nursing. So we're gonna go through all the other programs that we have for students to begin a career in nursing. And I think that's, when I look at our college, it's really exciting to know that students can come in with no college, with some college, with a 20-year career in something completely different from healthcare, and find their way through the different options we have. So before we get into that, I'm going to put a teaser out that we have a couple new things at the college that we're going to talk about today. I'm saving the best for last, I think. So you're going to have to stay tuned with us. But let's start with nursing, Dr. Kurtz. So really just the state of nursing. I mean, it's been a crazy 2 years through the pandemic. We've been here the whole time. We've been educating students the whole time, and really through our students doing, even at the college, doing clinical work, we've had a firsthand in just the front line of healthcare. What's the state of nursing today?
Andy, that is such a complex question. The state of nursing today is just in a state of flux. We have nurses who are reaching retirement age, and because of working during COVID and what I would term developing a sense of COVID fatigue, they are retiring even earlier. We have an expectation that about 500,000 nurses will be retiring in 2022 alone. And it will result in a shortage of about 1.1 million nurses over the next year. Wow.
Well, if there was a college to step forward and really help the nursing economy, we're the college. So let's look at some of our undergraduate programs. We have an associate degree in nursing. We have a traditional bachelor degree in nursing. And then we have a registered nurse, or RN to BSN program, for students who, whether at our college or another college, got their RN, and they're out working, and they can do that online. So let's start with our associate degree program. If you would tell us a little bit about the program, and what students could expect coming into that program.
Great. Well, thanks, Sandy. Right now, this program, our ASN program, that's an associate degree in nursing, is by all means at this time a weekend evening option. So what we see, students who are interested in this option typically are working full-time. They may or may not be married, but many of them have children and have a lot of outside obligations. So that evening weekend option is really important for them. And students who complete the associate degree, they take the NCLEX RN exam. It's a national licensing exam that all registered nurses must take. So whether a graduate is from an ASN or a Bachelor of Science in Nursing program, both of those types of graduates take the NCLEX RN exam.
Yeah, and it's, we, in our admissions department, we get the opportunity to work with all these students on the front end and really, take time with students. It's important to us to make sure that we're trying to match our students and what they have going on in their life, how much they need to work or not work, familial, like you said, obligations. So really in our admissions department, we work with a lot of our students really finding the best pathways. So when we look at a night and weekend associate degree program, or even our traditional Bachelor of Science program, it's really trying to find the best fit for students.
That's right. And so to your point, Andy, we have a lot of non-traditional students who also seek out what we term the traditional Bachelor of Science in Nursing program. Again, I think there is a lot of variety in terms of what this program offers. Even for students who are working and who have outside obligations. I'm sure you mentioned this last week for the Accelerated Bachelor of Science in Nursing program. That program is a 12-month intense, rigorous programs that students may enter if they have 68 college credits, or if they have a degree in another field and they take or have the prerequisite courses prior to coming in. It's not for the faint of heart. It's a very rigorous course, but we have great outcomes with students who are in that course. Again, our BSN program is a highly popular option, and we are very excited of the different types of opportunities that all of our students achieve, whether they're in an ASN, traditional BSN, or accelerated BSN. They all have good clinical experiences. We have the majority of our clinical experiences are with our Mercy One affiliates. So there's a lot of great acute care experiences, mental health, obstetrics, pediatrics. And another thing we offer is the simulation experiences for all of these programs. And we're just really excited about the future of nursing and doing our part to relieve the nursing shortage, especially in Central Iowa.
Yeah, and you mentioned simulation labs. I'm in one of the simulation labs with my stethoscope, pretending, to look like a nurse. So you mentioned our BSN program, and I think, just looking at how distinctive our program is, there's BSN options everywhere, right? And really helping someone understand why Mercy College of Health Sciences and why our BSN program. Some of the things that I look at it and I think it's just so distinctive to have this. Our BSN program starts all 3 times a year. We start fall, spring, and summer. So, students that have applied that are maybe coming into the fall and saying, I'm just not ready. They're not waiting a whole nother year. They can start into the spring semester and be right back on their journey. Because our program starts each semester 3 times a year, our program runs all year round. So if students have to take a semester off, they can take a semester off and they can join back in. It's an 8-semester program, so students can take summers off if they want. They can also go 8 semesters straight through, and they can finish what's typically a 4 to a 5-year BSN degree in about 2 years and 7 months. So, you could say that makes our program distinctive alone. Also, in the admissions process, Dr. Kurtz, there's not a wait. We don't have a low percent, selectivity rate. Students can start our Bachelor of Science in Nursing program when they meet college admission. So, I really look at and say, like, the access of our program it's just huge for students.
And I appreciate that you have lifted that up, Andy, because the access is really what we're about. We want to be friendly, student friendly, and be ready when students are ready to jump into their nursing education program, that we are here and ready for them when it's time for them. We also want to ensure that we are doing our part to educate nurses for our community, Des Moines area, metro area, excuse me, as well as the state and some of our surrounding states as well. So that access piece is hugely important. What really, I think, Andy, makes us distinctive as well is that we are able to take a large number of students compared to some other nursing programs, because we have the clinical sites to place students in, and we have the adequate faculty numbers to educate our students. And not every nursing education program has that luxury. So we're very blessed and fortunate to create this access for our students that maybe other programs aren't able to do. Not that they don't want to, it's just we are situated in a very good environment to be able to do that.
Dr. Kurtz, we actually had, we've got a question in our comments right now. Someone is interested in the ABSN program, but they're missing microbiology and A&P2. We do offer all of our prerequisites. So if you could get in touch with one of our admissions team members, we'd be happy to talk you through that. Now, Dr. Kurtz, when we transition out of the education, now we're looking at employment. The employment outlook for nurses right now, I mean, there's a shortage. So, when I'm talking to our students, some of our students, they're planning on staying in Central Iowa, which is great. For our students that stay in Central Iowa and they choose a career at Mercy One, our affiliated hospital system, for Mercy College of Health Science graduates right now in the field of nursing, they're offering up to $50,000 of tuition reimbursement, which is just incredible. Some of our students are looking at traveling. What a way to see the country. I say what a way to see a country on someone else's dollar, right? So there's just, it's so dynamic. And what I really love about, talking about nursing careers is with someone like you who, you started out as a nurse and, now you're the provost of a college. So what did, if you could tell those following and listening, what did your career look like? I mean, it started as a nurse, but there's been a lot in between.
Yes, indeed. And that's the beauty about nursing education. It can take anyone into multiple directions. And so I started out as a registered nurse, and I was an associate degree nurse. Over time, I worked on additional education. So I received my baccalaureate degree, my master's. I have a specialty and board certified as a family nurse practitioner. So I enjoyed years of that family practice and really, really enjoyed my patients. Also, I really enjoyed nursing education when I had an opportunity to serve as a preceptor for graduate nurses who were in nurse practitioner programs. So that led me into the academic setting. And so my career trajectory has changed, but I love it. And once a nurse, always a nurse. I'm still a nurse. And the beauty about graduates right now that I see that individuals have when they come into practice, that's a little bit different than even a few years back, is that if you're interested in a specialty area like emergency department, labor and delivery, pediatrics, intensive care, oftentimes now you can go right into that right after graduation. Historically, new graduates were encouraged to work in the med surg area in acute care settings, but now the playing field is different. So if an individual has an interest, a high interest in a specialty area, oftentimes they can have that opportunity.
That's fantastic, because that's what we hear in, through the admissions processes. This is, I'm so passionate, I want to do this. And like you said, it's just a lot different now where students are getting to do specialties right away. So maybe now is the best time to go back to the teaser that started this Facebook Live. This fall, we are delivering our very first graduate program, our Master of Science in Nursing, with the Organization and Systems Leadership. So I'm not going to steal your thunder. Tell us about the program.
Well, thank you, Andy, because I'm always excited to talk about this program. First of all, this program was intentionally designed for nurses to move up into leadership positions. As I mentioned earlier, many nurses are retiring, and so we need individuals who can understand big health systems, who have the business, business skills to be true team players at the table with CEOs and boards of directors in terms of that patient healthcare experience. And so there's just such an opportunity to grow in terms of that leadership function, that communication function, the critical thinking piece, but also how to run large organizations from that system standpoint and through a business lens. And so we're very excited about this opportunity. And we chose this pathway based on recommendation by our healthcare affiliates. They were really wanting individuals to be prepared to be nurse leaders in especially large acute care organizations.
So I'm going to come back to this, but we did have a question that came in, and the question was asking what areas of the hospital do students do clinical in? So I'm going to tee that one up too, because
sure. Clearly medical surgical areas. We do try to get OR, operating room experiences for students. Sometimes that's hit and miss depending on, recently COVID, for example, but obstetrics, pediatrics, we try to get some students into primary care, community organizations, that community health focus piece. Let's see, what have I left out? Mental health, just about any type of nursing specialty one can think of, we can typically give that experience if a student has an expressed preference, especially when they're at the end of their program and wanting to do a preceptorship in a particular area.
It's kind of a timely question, and I appreciate your answer, but it's a timely question because we're talking about our new MSN program. The feedback that we got was we need nurse leaders. We need to educate them on understanding the hospital system so they can contribute at a high level. And there are other MSN options. People can go other places, they can go online, but truly this is a distinctive program that is keyed in on helping, just like you said, that nurse that they went through their BSN, they've got all these clinical experiences, they've kind of dabbled in different things. Now they're out on the floor, they're practicing, they're working with all the levels on the floor, from nurse managers to doctors to all the specialties that help out on the floor. And this education with the organization and systems leadership is really focused on helping that person have a deeper understanding of the hospital system and contribute at a higher level.
That's correct. What I envision is when a student completes this master's program, they will have the skill set and underpinnings they need to work as a system chief nursing officer or a systems leader in a healthcare organization.
So I get that, I just trying to draw a parallel. It kind of seems like the person who finished a business degree that naturally moves toward an MBA to, look at advancement and kind of see bigger pictures of business. This is kind of akin to that, really. The nurse that's on the floor. Our master's degree program is one that is set up to help them, really have that channel of leadership, contributions, and then, roles as you just described.
That's right. And the big change that I've seen, Andy, in nursing over the years, when I entered the nursing profession, we were still debating on whether nursing was even a discipline. And we were thought to be handmaidens, of our physician colleagues. And, those days are over. We're all collaborators. We all work together as a team, but nursing now is recognized as a high-level skill set and profession that, as we've seen through COVID, that our country desperately depends on to offer healthcare, and most importantly, that safe, high-quality care that all patients deserve.
Yeah, I don't think you could be, more accurate in just, how you've described the kind of even a short timeline, in the history of nursing. Interestingly, my wife is a nurse at Mercy One, and, in the role that she has through the pandemic, we've both had some days together working at home, and when she's on the phone with physicians as they're doing rounds, I'm honestly blown away by her knowledge and what she does. And it's not to cut her short. I just think the development of the role, and I think the importance that everybody recognizes that nurses do, and the knowledge that they have. So I just think that advancement in the field is such a compliment to nurses over time. The contributions that they've made.
I totally agree. The level of autonomy that nurses have and respect that we didn't have in the earlier days, but now it is a very collaborative environment. We collaborate with our healthcare partners, our physician colleagues, our pharmacist colleagues, our physical therapy colleagues, or therapist colleagues, all of the different disciplines that contribute to patient care. We all work together because we know the state of the science tells us that's the best care that we can offer to any patient. And so, the old days of nursing are gone, and it really is a very rewarding profession. It's a very intense profession, and it takes a lot of dedication and commitment to, to really offer the care that patients need and deserve.
So two final questions just to close on our MSN program. So fall 22, it's going to be our first cohort. We will have a cohort of 15 students. And if you could explain the delivery of the content. So how will students learn? We've noted that it is a hybrid program in terms of lectures, experiences. Can you kind of paint that for those that are listening and interested?
Sure. I am just very excited to say this program is an online program. So students will be able to take courses online at their convenience. Most of the courses will be asynchronous. And what that means is that you won't necessarily be meeting with your group at a particular time. There might be a few courses set up where maybe once or twice a term the class comes together as a group, but really overall it is a totally online program. Now, students who doesn't matter where a student lives, so whether they're in Des Moines or Omaha or Indianapolis, they can go within their own community and perform some of their clinical assignments within their own community. And so we've been very deliberate to make this as student friendly as we can, so that any person, no matter where they live, can access this program.
And to access the program, students can go to mchs.edu/apply. Our application is free. The application maybe takes 15 to 20 minutes to fill out. You'll send all your official transcripts to our admissions team, and we'll move your file forward from there. So I think we would only be good colleagues to our HR team to plug working at Mercy as a nurse, right? So we have faculty that with a BSN can do lab and clinical, with an MSN can start into lecture, and in our MSN program with a doctorate you can teach. So go to our employment page, apply to become a faculty member. We're always looking for more faculty.
Yeah, great, Andy. Thank you for that plug. So yes, if there are any nurses out there that have a doctoral degree, that have a master's degree, and are interested in teaching, the theory or didactic portion of a nursing course, or want a full-time position, we are looking for high quality individuals to come and teach. If you have a bachelor's degree and you live in the Des Moines metro area, or even perhaps the Iowa City area, please fill out an application too. We certainly could use you in lab or clinical. So we would welcome some good applications or good applicants. And Andy, thank you for giving us a plug.
Well, Dr. Kurtz, I think we should wrap this up with one final question from a viewer. And that question is, do you have any recommendations for students going into nursing, how to prepare, and any other advice?
I wish every student asked that question. First of all, it's really important that an individual is ready, that their life is as unchaotic as possible. Sometimes that's not always the case, but just know that it takes a lot of time to study, and making sure that you have all of the pieces in your life in place to give you that time to really devote to your studies. It doesn't last forever, but it's pretty intense while a student is in the program. So just be ready to be dedicated to the work. And again, just know it will be over, and you will soon be able to work as a nurse and enjoying your newfound career.
I will say, for those watching that don't know, we're a small school. We have just over 800 students. If you're looking for a place where people will know you by name, you'll know your faculty by name, your support team, your academic advising team, this is the right place for you. Dr. Kurtz, I really appreciate the conversation today. We really had a lot to talk about between our nursing programs, kind of difference between the nursing programs, the marquee debut of our MSN program. We're so excited to bring students into our first graduate program. Those following, we will have another Facebook Live coming up soon. The teaser is it's our paramedic group We're going to have a student who's been through the program in a remote location. We'll have someone joining us from a fire department who's actually hosted a paramedic cohort for a few years. It's really going to be a good kind of town hall feel. But for today, all things nursing, thank you again, Dr. Kurtz, and everybody have a great Easter weekend, and we'll see you all on here soon.
Thank you. Andy, may I comment on one thing you said? For the sake of the group, for our community, we are a small institution, as Andy indicated. However, we have one of the largest undergraduate nursing programs in Iowa. So we're very proud of that fact. And we hope that someday we can say that about our graduate program as well. But we are solid in nursing education. So thank you, Andy. Thanks for the invitation. Goodbye, everyone.